Well, it's probably not the news you want to hear as you get ready to ring in the new year, but flu cases are skyrocketing across the country. According to brand new numbers from the CDC, 29 states are experiencing high or very high levels of flu-like illnesses. This comes as the CDC reports at least 7.5 million flu cases with 81,000 hospitalizations and 3,100 deaths so far this season. Dr. Stephanie Widmer joins us for more on this. Stephanie, just talk to us about why we are seeing this surge that seems more than usual this time of year.
Sure. So we're experiencing an unusually early and intense flu season, and this is for a number of reasons. There is a fast spreading flu strain that's dominant right now of influenza A, specifically a variant of H3N2, or we call it a subclade. You may have heard this term, subclade. Subclade K is circulating right now, and it appears to spread very efficiently. It's moving quickly. On top of that, we have holiday travel and indoor gatherings that's certainly accelerating transmission. And then there's lower immunity. So many people may have skipped or delayed their flu shots this year. Protection from prior seasons tends to be wearing off at this point. And all of these factors combined are really causing this surge that we're seeing.
Is the flu shot still effective with this new variant, Dr. Widmer?
I definitely want to stress that the flu shot still works where it counts most. It decreases hospitalization, severe illness, and death. So while it may not be a perfect match for this flu variant that's circulating, do not hesitate to get your flu shot. It's very important, and it really works.
Very important, not too late. So we know a lot of people are going to be gathering for New Year's Eve. You know, you're in close quarters. Probably going to happen even though we have this spike in flu cases. So what can people do to protect themselves? How do you take the steps you need to maybe not get sick if you're not sick already?
Absolutely. So there are very simple things that we can do, right? We can cover our coughs and sneezes. We can consider masking if we're in crowded spaces, wash our hands frequently. Like we said, get your flu shot. And then, of course, stay at home if you're sick. And I do want to stress this because what may feel like a tickle in your throat or a little bit of a runny nose for you may be a very severe infection with the flu for someone else. So, you know, we want to try our best not to get other people sick. And we really want to protect our high-risk populations or individuals with underlying medical conditions.
If you do get the flu, what's the best way to treat it? What do you recommend?
So I definitely recommend to start treatment early. If you develop flu symptoms, contact a clinician. But the mainstay of treatment for the flu is really supportive care at home, getting plenty of rest, staying hydrated, over-the-counter medications like acetaminophen and ibuprofen for fever and body aches. There are antiviral options, and that is something to discuss with your doctor because there are a couple different formulations that have different indications. So if you're experiencing flu symptoms, it's important to touch base with your doctor to see if one of these antiviral medications may be indicated for you. And then, of course, if you're experiencing any severe symptoms like chest pain, shortness of breath, too weak to walk, if you're vomiting and can't hold down food, or you're just overall too sick to really take care of yourself, then it's important to seek medical care immediately.
Good advice. Not the rest and taking easy, not exactly what most people do New Year's Eve. Try to have people heed that. Dr. Stephanie Widmer, thanks so much.
Yeah.